Hi, my name is Brian Poludniak. I'm the head physical therapist at Health Solutions Centers. We're in Vermilion and Lorain, Ohio, on the west side of Cleveland, and we offer physical therapy services and chiropractic services. Today we're here to do a brief video on proper standing posture. So a lot of us have experienced back pain, I'm sure, when we've been standing in one place for too long, such as maybe being in a line for a checkout at the grocery store, maybe a sporting event, even at church. Your back starts hurting, your hips may start hurting. So today we're here to talk just real briefly about how to stand in one spot with the proper posture. It's going to help with your joint alignment and take pressure off your spine at the same time. So we'll start with the basics. We're going to go down, we'll start at the feet. When you're standing in one spot for a long period of time, what's important to remember is you want to keep your feet about shoulder width apart, maybe a little bit wider. You want to keep your feet pointed as forward towards whatever you're looking at. So if you're looking at something in this direction, you want to make sure your body is not turned this way. You want to keep everything in one direct alignment. So when we move up to the knees, at the knees you want to keep a slight bend in the knees. You don't want to keep them locked out backwards. That'll help take some pressure off down there at your back and at the knees. And moving up to the hips and low back region, something a lot of people find themselves doing is standing with our back arch like this. Now what you need to do there is you need to bring the stomach in, kind of activate the abdominals. A good way to check this is if you're standing up against a wall, if you're able to just kind of slide your hand back there, you feel a pretty good firm pressure from the wall between that and your back, that means you have pretty good posture. You want to avoid having too much space where you can fit almost a fist back there. That's going to help take a lot of pressure off the hips and low back. So moving up to the shoulders, obviously we all heard you want to stand with your shoulders back, and then the head also comes into play at this point. To keep that all in line, you really want to focus on keeping the ear, the hole in your ear, aligned with the very center of the outside of your shoulder here. So you want to keep that chin back, shoulders back, and keeping all this stuff in line is really going to take a lot of pressure off the spine as well as our knees and hips, and it should really help you guys out if you're standing in one spot for too long. You don't have anywhere to move around. Otherwise, sometimes taking your hip and just kind of bending the knee and propping your foot up on something nearby, that can also help out if you're stuck in one spot like that for an extended period of time. For more tips like these and any more information on our clinics, you can find us on Facebook at Health Solution of Vermilion or on Twitter at HSC Therapy. Thank you for watching. Have a great day.